Assessing blood pressure. Good day, learners. This presentation will deal with assessing a patient's blood pressure and will assist in your preparation for assessment. Blood pressure measures the force of the blood on the inside of the artery walls. It has two components, namely the systolic and the diastolic pressure. The systolic pressure measures the force of the blood when the heart contracts, and the diastolic pressure measures the force when the heart relaxes. The most commonly used site to assess blood pressure is over the brachial artery. Blood pressure readings are stated as the systolic pressure over the diastolic pressure. In other words, the highest reading over the lowest reading. For example, 120 over 80. The unit of measure used for blood pressure is millimeters mercury. Purpose: assessing blood pressure is a generic, basic nursing care standard to be mastered by all learners. Learners skilled in the standard will be able to obtain baseline blood pressure measurements and identify and monitor changes in the patient's blood pressure due to illness or therapeutic interventions. Specific outcomes. Learners who have been assessed and found competent in assessing blood pressure will have achieved the following specific outcomes and will be able to use the appropriate equipment according to the patient assessment, measure a blood pressure accurately, prevent injuries and cross-infection to the patient, and to interpret blood pressure readings and record and report findings correctly. Embedded knowledge. Embedded knowledge represents what you as a learner has to understand and be able to explain in an area of learning and at a particular level. You as a learner should have mastered all the theory related to blood pressure. You should have sound knowledge related to the anatomy and physiology of the circulatory system. You should understand the medico-legal aspects regarding to the monitoring, recording and reporting of a blood pressure. And you should have attended a demonstration in simulation on how to assess blood pressure. Range statement. Assessing blood pressure is a generic, basic nursing care standard, and learners can be assessed in their field of learning in line with subject matter expertise. Procedure. The procedure will be performed according to the nursing process. Assessment. Greet the patient and introduce yourself. Ask the patient to state his or her name. Check the patient's name and identification number on the patient's identification bracelet. Compare the patient information with the patient's records. If the patient cannot identify him or herself, verify the patient's identification with a second staff member who knows the patient as a second source. Explain the procedure to the patient and obtain the patient's permission. Check the physician's order or the nursing care plan for the frequency of blood pressure measurements. More frequent measurements may be appropriate based on nursing judgment. Appropriate nursing diagnosis may include decreased cardiac output, ineffective health maintenance, ineffective therapeutic regime management, and risk for fall. Assess all factors that could influence blood pressure readings. These include age, gender, race, physical activity, emotions and stress, obesity, medication, and diseases. Please note that the patient should not have any coffee or cigarettes 30 minutes prior to a blood pressure measurement, and should also not have participated in vigorous physical activities 30 minutes prior to the assessment. Assess the patient for any pain. If the patient reports pain, give pain medication as prescribed by the doctor before assessing blood pressure. If blood pressure is taken while the patient is in pain, make a notation concerning the pain if the blood pressure is elevated, and give feedback to the registered nurse. Assess for the appropriate arm to use. The assessment includes limitations such as intravenous infusion, breast or axilla surgery, presence of a cast, arteriovenous shunt, and an injured or diseased limb. Blood pressure should not be monitored on an affected limb. If you cannot assess blood pressure on either of the patient's arms, assess the blood pressure on the patient's upper leg, palpating the popliteal pulse. Assess the size of the chosen limb so that the appropriate sized blood pressure cuff can be used. Planning. Assemble the following equipment: a stethoscope, a sphygmomanometer, an appropriate size blood pressure cuff, a few alcohol swabs, and a pen and the patient's vital signs record or control chart. Always ensure that the equipment to be used is in a clean and correct working order. As mercury sphygmomanometers are being phased out, we will make use of an aneroid manometer during this demonstration. Implementation. Provide privacy for the patient where possible. Perform social hand hygiene. Assist the patient into a comfortable lying or sitting position. Support the patient's arm so that the forearm is at the level of the patient's heart. The palm of the hand should face upwards. Expose the brachial artery by removing garments or by moving the sleeve above the area where the cuff will be placed. Sleeves should be loose fitted to prevent constriction. Center the bladder of the cuff over the brachial artery, about midway on the upper arm, so that the lower edge of the cuff is about 2.5 to 5 centimeters above the inner aspect of the elbow. Align the artery marking on the cuff with the patient's brachial artery. The tubing should extend from the edge of the cuff towards the patient's hand. Wrap the cuff around the patient's arm smoothly and snugly and fasten it. Do not allow any clothing to interfere with the placement of the cuff. Position yourself close to the patient's side in order to read the gauge and support the patient's arm. Palpate the location of the brachial and radial pulse by pressing gently with your fingertips. Palpate the radial pulse. Check that the needle on the aneroid gauge is within the 0 mark. Tighten the screw valve on the air pump and start inflating the cuff. Continue to palpate the radial pulse. Note the point on the gauge where the pulse disappears. Open the valve and slowly deflate the cuff. Note the point on the gauge where the pulse reappears or can be felt again. This is the estimated systolic pressure. Open the valve fully and deflate the cuff completely. Wait approximately 15 to 30 seconds before inflating the cuff again. Clean the earpieces of the stethoscope with an alcohol swab and place the earpieces into your ears. Wipe the bell and the diaphragm of the stethoscope with another alcohol swab and place the diaphragm of the stethoscope firmly but with as little pressure as possible over the brachial artery. Do not allow the stethoscope to touch the patient's clothing or the cuff. Calculate the maximum inflation level by adding 30 mm of mercury to the estimated systolic pressure. For example, if the radial pulse disappeared at 110 mm mercury, your maximum inflation level will be 140 mm mercury. Close the valve and inflate the cuff as rapidly as possible to the maximum inflation level. Open the valve and allow the cuff to deflate slowly and consistently, allowing the gauge to drop 2 to 3 mm mercury per second. Note a point on the gauge where the first sharp rhythmic sound appears. Read the pressure as it appears on the gauge. This number is the systolic pressure. Please take note that if you are unsure of a reading, do not re-inflate the cuff. Deflate the cuff completely and start again. Continue to release the pressure slowly, listening to the thumping sounds. Note the point on the gauge where the sound starts to be muffled or completely disappears. This will be the diastolic pressure. Continue to release the pressure slowly for another 10 mm mercury to ensure the absence of the sound is not a skipped beat, but is the true end of the sound. Open the valve completely and allow the rest of the air to escape quickly. Remove the stethoscope from your ears. Remove the cuff. Clean and store the blood pressure apparatus according to the internal policy of the facility. Clean the stethoscope with an alcohol swab. Thank the patient and make the patient comfortable. Ensure that the call bell and all necessary items are within the patient's reach. Perform social hand hygiene. Evaluation. The expected outcomes are met when the blood pressure is measured accurately without the risk of injury or cross-infection to the patient, and that the appropriate follow-up measures were applied. For example, administering medication and implementing safety precautions. Record keeping. Record the findings on the patient's vital signs record and progress report. Record the site of assessment if the blood pressure was not measured at the brachial artery. Remember to write the date and time and to sign the entry. Compare the readings with the previous set of readings and the baseline data. Report any abnormal findings to the registered nurse. Special considerations. Difficulty in hearing the blood pressure sounds. With the cuff still in place, carefully elevate the patient's arm for 15 seconds before rechecking the blood pressure. Inflate the cuff while the arm is elevated, and then gently lower the arm while continuing to support it. Position the stethoscope and deflate the cuff at the usual rate while listening for the sounds. Skills variation. Assessing blood pressure using an electronic device. Automatic and other electronic equipment, for example Dynamaps, are often used to monitor blood pressures in the following conditions: hospitals, acute care units, high care and intensive care settings, during anesthesia, post-operatively, or when frequent assessments are necessary. Automatic and electronic machines can be set to take and record blood pressure readings at preset intervals. Procedure. Assessment and planning phases will be the same as when you use a sphygmomanometer. Implementation. You will also follow the same implementation procedure up to the placement of the cuff. The cuff is applied in the same position and manner as the auscultatory method, with a microphone or pressure monitor positioned directly over the artery. Instruct the patient to keep their arm as still as possible. Turn the machine on. If the machine has different settings for infants, children and adults, select the appropriate setting. Push the start button. Wait until the machine indicates with a sound or screen indication that the reading is complete. Note the digital readings. Remove the cuff from the patient's arm. Clean and store the equipment according to the internal policy of the facility. Thank the patient and make the patient comfortable. Place the call bell and other necessary items within the patient's reach. Perform social hand hygiene. Record and report the measurements accordingly. Please remember to check the cuffed limb frequently when using an automatic blood pressure device for serial readings. The cuff should be deflated completely between measurements to prevent inadequate arterial perfusion and venous drainage, and compromising the circulation within the limb. In conclusion, it is important to indicate to you that the healthcare giver is an important role player in the monitoring and treatment of a patient. Whenever patient care is provided, adherence to infection control guidelines is needed to ensure that all care is safe care. Perform your task as per this lecture and to the best of your ability, always keeping in mind your scope of practice.